So in brief, we have been working as a subcontractor to USAID contracts for more than 12 years. We worked with MSH. I'm sure you all know the names. We worked with Chemonix. We worked with PATH and also UNFPA. For the last 5 years, we have been working on developing information systems based on the DHIS2 platform. And the softwares that we developed, it went to 19 countries, so we will see on the next slide. So I'm guessing I will continue, and at the end we can take questions. We will have, we will try 15 minutes to have the question answer session. So this is kind of it may not be very clear on this side. So this is kind of the countries that we covered or touched with our health information systems. The yellow ones, the light yellow ones are the ones which involves DHIS2. So like in Mali and in Burkina Faso, Benin, DRC and Botswana, we developed systems which involves work inside the DHIS2 and interoperability with custom systems, and sometimes everything is inside DHIS2. So the others are not inside DHIS2, but all are related to health, logistics, and stock management or patient management like that. So apart from Africa, on the left in the small, you may see that we also have our, as we are based in Bangladesh, we also have most of the health information systems used by the Ministry of Health and Family Planning in Bangladesh are developed by us for more than 10 years for now. Okay. So the session of today, what it is, in one line, if you ask, okay, what is it? It's an inventory management. It's a custom web app and an Android app together to make up the software, which the main thing is the data is stored inside the DHIS2 database. No hacking, we just save it as of the tracker and like those. We will see how we do that. So the major features, if we may say, there are 4 features, if I am not wrong. This is the pointer, right? At the top. Okay, great. So it's transactional. This is important. There are LMIS. We didn't want to, that's why I say ELMIS. This is a transactional stock management. Means it's an everyday thing. You have to do receives, issue, dispensing, stock adjustments. Everything has to be entered by the operators in the system. So what you get is stock managed by batch and expiry. So it's like, so you know that if anything is expiring, you can get it quickly. Then every country has this option of month-end LMIS reporting, right? They have to submit a report which is manual. Some countries, they type it in the software. So here, the LMIS report would be generated automatically because you are doing the transactions, the system can generate the month-end report. And then, as I said, all data is inside DHIS2 platform, not outside. So in a way, what are the main functions? You can do stock takes, means physical inventories. You can do orders. You can do receive of the stock, issuing of the stock from the warehouse to the lower level. You can do dispensing, patient dispensing, stock adjustments, month-end reporting, and the stock balance is always available and updated. So this gives a kind of a workflow, like how the system can start in a facility and then it starts using. So every facility has to be initialized, like means you have to say, okay, this facility, they will start using the soft LMIS. Then they log in, and then you have to do initial stock take. Like, you have to do a physical to start your software. Then the average use, that's what we say, like AMC, average monthly consumption, that need to be entered so that the orders can be generated. Then the main tasks of the month, like you can do stock takes, receive, issue, all the regular functions continues for the month. And normally at the end of the month, you can generate LMIS report. That's why we put it at the end. And although we have put it at the end, the sync can be any time. So when I say sync, it has it's hybrid, means you can save data locally. That's the I would say the main essence, we all know that internet is a problem everywhere. So data is saved in different ways locally, which needs to be synced. It goes to the DHIS2 main platform. And then even when you want to restore, it comes back from DHIS2. If you lose your data, then you can just say, I want to restore down, then it comes down from DHIS2 also. So also there is a little color variations here, if you may see online and offline. So most of the tasks, if you may see, can be done without internet connection completely, even while in the web. I'll explain later how. So as I said, there are two components, a web-based part, which is in the DHIS2 platform, that can be also executed offline, and an Android app, which is always completely offline. So what are the major features? We might have said a few of them. So is the echo, is it only I'm hearing the echo, or it's happening? Sorry. Okay. So as I said, it's fully offline. And those who work in the LMIS, they know that AMC is average monthly consumption. So how much do you need? That's actually normally a 90 days running average or 3 months average. That is calculated based on your data. And MOS, they say month of stock, like how many months do you have? So those are calculated automatically. Then the bottom says one-click restore, means it's actually a click. You just install it in another tablet or another computer, and then you say restore, and the data, if internet is available, data will come down and it restore and you start using it again. There are some other indicators are calculated, batch and expiry, and the alerts. So like there are periodic alerts. For example, at the end of month, facilities having stock out and nearly stock out, that email will be sent to the managers that, okay, these are the facilities having these products which are dangerously low in a way. There can be, there are event-based emails. For example, when a warehouse issues commodities to a lower level facility, so the facility receives an email that your products are on the way. Like that, or if an order is generated, an email and SMS. We implemented in Burkina Faso the SMS system, so the SMS goes to the facility operator and manager that an invoice is on the way. So this kind of event-based as well as periodic email and SMS alerts are integrated. So when we say FIFO, that's in the logistics terms, they say first expiry, first out. Means when doing the issue invoice, the software against an order, software LMS will propose that you should issue the batch which is expiring early. So that's the propose, but it allows you to change it also if you want to change it. So when I said like, no hacking. So what we did, on the left side, we say what we used in DHIS2. So we are saving data inside some data is stored inside the DHIS2 aggregate. Like if they were entering data manually, but we are not doing it manual, the software saves the data inside. So the LMIS report or the current balance is stored inside the DHIS2 aggregate. The transactions are stored inside the tracker. So as an example, when you say like, what does tracker do? You can track patients and their measures or their medicines like that. So we are considering the transactions like, an invoice as a tracker. So the invoice has products, quantities, expiry dates. Those are treated as properties of that tracker. So we mimicked or represented it that way. And the events, we are also replicating the tracker data to the events because it is difficult to do reports using the tracker data. Tracker is one tracker. But when you have the data, reorganize the data as event, then it is very easy to do reports. For example, how do you do a ICR or stock card in DHIS2? That's not really normal. So we save it as events, so that you can say, I want to know about the events from 1st to 30th of this month, which means I want the stock status or stock movement of 1st to 30th of this month, like that. So these are the three major areas where we are storing the data. And on the right side are our add-ons, whatever we added to it. So we made a custom app in React, which is what DHIS2 proposes, that softwares have to be developed using React platform normally. The web-based app, we have a web-based app, which is React, and we have an Android app, which is React Native. So, we don't want to monitor too many software. So that, this is one thing that we did. And then we have a middle tier that we say, that we have between DHIS2 and the app, or the Android app, there needs to be a, via, like that, the DHIS2 has APIs. But sometimes when it's transactional, you need to make sure that, okay, the transaction is saved and the stock is updated. So there are multiple tasks. So using our Node.js middle tier, we make sure that data is synced properly and we log the errors and success, whatever, all those things are managed using a Node.js in a way that's also an app which needs to be installed on the same DHIS2 server. That's normal, so that can be done. We also have developed some external APIs. For example, the countries were asking, okay, we have Sage. It's an enterprise warehousing management system. We have been using Sage for 10 years. We don't want to replace it with your small software. Like, it's not a warehouse management, our one. So we have made APIs so that they can send the data from Sage to the DHIS2 platform via SoftLMIs in a way. So these APIs are there, which can be hooked by any. I mentioned about Sage, but it can be any enterprise software that can send data, and we can take the data if the format is correct. So that's why these are the three add-ons that we did under SoftLMIs platform. What else? Okay, so it can run on three models. One is, like any software, you go to DHIS2 website and you can just install the app and start using it online. Like, you don't need, if you want to do it directly, like, immediate. The second option is how the web app works. The web app works in online-offline mode, means the DHIS2 website is online, but the data is stored in your computer's browser's local, we call it IndexedDB. So it is stored in your computer. So when internet is not there even, you can continue using the internet. Let's say internet cuts off, but the software will not stop, even if it's a website. That's how the technology works. So then when internet is back, then you have to sync the data. Okay, if you do not sync and you turn off your computer, the data doesn't go away. Until the online-offline model has one disadvantage in a way, I would say, until you clear your browsers or your computer is crashed, then you lose the data. Otherwise, the data remains. Then there is the third one, is the tablet-based version. We have recently finished the development of the Android app, which is completely offline, means you log in your tablet. The first time you would need internet, because internet has to know that you are a valid user for this facility. And then the ID password is cached in your Android tablet, and then you continue using without internet. But periodically, definitely, you need the data to be sent to the server, because everyone has to see what you are doing at least once a month, because the LMIS report has to go there. So this is how the software, three models, the software can work. So someone was asking in our exhibitor stall that at which level will your software work? Theoretically, it should work anywhere. Like, the software is designed such that if you are in the central warehouse and you are assigned ID password, you can use SoftLMIs to manage your stock. Receive from external sources, like shipments, you issue to your lower warehouses, everything works. Even the regional warehouses and the health facilities, you can use the software at all levels. And the national level, they will come to the DHIS2 dashboard to see the reports, which gets automatically generated. So these are a glimpse of some of the reports that we have. We have more actually. And the good part of DHIS2 You means anyone who has implemented it in their country can do their own reports, because DHIS2 allows you to design reports from there using their wizard. This is kind of how the implementation might work. That's what we say. So as we have an engine ready, like we have the system kind of working. So let's say a new project comes up. What will we do? We will discuss to find out whether the current software, does it serve or no? In your country or in your project, there is a specific additional requirements. Then we find the gaps. Then we customize the app to incorporate those gaps and update it or a little customize it for your needs. Then we conduct a UAT, that's what we call user acceptance, means we have to show you your app and then you say, no, I don't like it because this has to be like this. So during UAT, there would be even more feedback, small feedbacks maybe, or even more. Then we finalize, update the software based on the pilot. Then we do a central level orientation, means it's not only the ministry, it can be the, the other stakeholders, or even some people from the field level who would be using the software, because you have to get their feedback also about a software which you are implementing. Then there can be pilot training, like normally every country they choose, okay, 2 districts we want to see, or maybe 10 facilities we want to see how the software works. Based on that, let's say it works a few months, maybe you need 3 months to run the pilot, and then you decide, okay, now if you accept it, if the users have accepted and the pilot results are positive, then you have to plan for a national rollout, like, how are you going to roll it out, who's going to pay, and are there computers available, do you need tablets, is it computers, who will pay for the internet? And we normally do, in every country, we normally do TOT2 master trainers. We normally do not go to every district remote and then do 1,000 people's training. No, we have to make sure that the country has enough trainers so that they can periodically do the implementation and then they can manage that. Otherwise, it is difficult to sustain things. After that, I would say, after that, we normally say, after that, it's inside the country. We do not normally need to get involved in national training, rollout things. If the software doesn't break, that's definitely, if that help is needed. Okay. So, how do we transfer the knowledge? I remember as Lukba was saying at some point, like the white elephant thing. Anyway, so we have training materials, we conduct TOTs, we have training guides, and the most important one is this one. We do not, in any of the project ever in last 12 years, we have never kept the source code to our custody, that no, we are not going to give it to you. We hand it over. Sometimes we know that, if the ministry do not have enough capacity to manage that, that's another thing. But if, we do not keep an if anyway. So we always give the source code to the country, and then they can use it themselves to make sure that they can update it. If not, they can ask us to manage it. That's also there. But the main thing is, in any contract, we never kept the source code to ourselves and kind of periodic license fees. So why soft LMIs? We didn't really want to compare with OpenLMIs, compare with X, compare with mSupply. We say that no, why soft LMIs? Because as it's under the DHIS2 platform, so it gives you some competitive advantage, right? So country staff are able to design their own reports if they are trained, if they know DHIS2, right? If they know how to design analytics in DHIS2, they should be able to design new reports. And if it's in one platform, you are able to correlate the stock and patient data, right? At some point you can say, okay, how many Abacavirs and how many like that. It's not that easy, but we know that it is possible in terms like you can say, okay, malaria, artemethyl-lamivudine, how many packs given versus how many severe malaria patients, severe plus simple. It may not correlate, then you have to dig out more. like that. And then we say that it works in low resource, means continuous internet is not a must, but at least you would need at certain times when you want to sync or when you are giving out an invoice. Good part of it, I didn't mention it somewhere, like if, let's say everyone is using the software LMI. So if the warehouse makes an issue invoice to give it to the facility, the facility can download that issue invoice from SoftLMIS and then can use it as their receive invoice. Means data entry burden is reduced. Even the orders, if you create an order with 100 products, the warehouse can download the order and create an issue invoice. So all the typing of the product names, order quantities, you don't have to do it twice. So as much data entry burden reduction as possible. We tried that, data exchange between sites. What else? They can add new reports and no license fees. Like we will not say, okay, 1,000 sites every month, you have to pay us money for running the sites. No, we don't. So it has to be hosted somewhere. The hosting has to be managed finally by the country, or we can manage it, or it can be even be BO systems. We all know BO has very good data centers. So, and this was not a future. We have done the Android app, and in the future, definitely we plan to do GS1 compliance. We all know that, like the JTINs and like those scanning. While you are dispensing, there are barcodes now in the medicine boxes. So if you want to make the dispensing module more advanced, you can scan the boxes. So those functionalities would be included. And then the printing things, because we didn't now go to the printing, we think that it's digital. You don't need to really print. You can click and download the invoice, you are seeing it. You don't really need to print papers and sign. The data is there in the system, you can verify. And what else? The barcode scanning option is definitely a must. And then, no vendor lock-in, as we will share the source code. You are not bound to work with us. We will give the React.js code of the app and the web. So for how much time do we have? I'm not looking at the clock, sorry. So we have 20 minutes. Okay, I will wrap up very quickly for more questions coming. So typically this is, I took these screenshots from the app. It's an Android app screenshot. So it shows the current balance, current total balance of each product. You can see here, this is a product name, the product SKU, the balance is there. And then you can see, as I was mentioning, the batch and expiry, products by batch and expiry. That's a view page, which you can see. This is a typical order entry page. So the order has a number, ordering to, facility name, and these are the products you are ordering. And it will catch how much do you have now, how much do you need. The software will calculate automatically based on your min-max. That's what, the countries have rules to do that. This is the receive. It can be manually entered or it can be imported, as I mentioned earlier. So during the receive, it also brings in the batch and expiry that was issued to you. So you don't have to type and you type a wrong batch number. So that's been prevented. Then this is the dispense. Although, just to mention, this is not a patient dispensing module. Like you do not put the patient's name. It's not that complex. This is like in the simple facilities, in the small facilities, at the end of day, you sum up the numbers and then you just put, okay, today we dispensed X. If you want, every patient-wise dispensing module, we have another software called eDisp that we implemented in Benin PEPFAR sites very recently. That it's actually for the ART program. So every ART patient's what you are dispensing, against which regimen, and what medicine, the quantity, stock management, everything is integrated there, including the patient details and like that. But this one is simplified. It just has the total quantity. When you have stock adjustments, like, you can have physical counts, you can have wastage, you can have expiries. All those adverse events can be handled from here. You can define your own adjustment rules. Like some countries say, I don't want to say, theft. I want to say, adjusted like that. So you can define. So these are the physical inventories. You have to do a initial physical inventory, and then you have, in countries where they can do periodic inventories as well. As I said, LMIS report in one click. At the end of the month, you can say, I want to generate my LMIS report. Then it generates the summary of the month. One important variable there, what we found countries struggling, is the number of days stock out in the middle of the month. Means you have to then go back to the stock card, count by product. So here, Soft LMIS knows which days you became stock out in the middle, right? And which day receive again came. So that variable is calculated automatically, number of days stock out in the middle of the month. So those, and average consumption, MOS, everything is calculated. So this is a typical dashboard from, it's a dummy data. So we implemented versions of Soft LMIS in Burkina Faso and Botswana. In Burkina Faso, it is a national system. They have 2,000 some products. And in Botswana, it was targeted for the COVAX tracker, means the COVID vaccine. So they wanted to monitor it by batch and expiry. So as the default DHIS2 module, I think it doesn't have batch and expiry. That's why we proposed, and they accepted the model. So the vaccines are being managed like this. So they have a vaccine dashboard where you can see a summary, you can see wastage, you can see expiries. Let me go to one or two reports. Like you can see on a map, this is this is not the default DHIS2 map. We have done a few custom reports inside DHIS2. Why it has to be custom? Sometimes because, in DHIS2 sometimes quickly changing a product and seeing the report is sometimes a little difficult. But anyway, so this is the batch-wise stock status. What are the batches that you have? And like, let's say, batches going to expire in 60 days. So this is one very important thing for vaccines, because we all know vaccines were very short dated and they have to monitor. So this report helped them. And this is the most complex report, I guess, that's normally not possible in DHIS2. Is there anyone from DHIS2? Anyway, so this is a complicated one which says, okay, from on the day one, how much did you have? And it's like a bank, it's like your bank transaction thing. On the first day, I had this, and then the receive, issue, dispense, adjustment. What is the last day's balance that would be available at the end? So on any inventory system, you definitely need a stock card implemented, otherwise they would never use it. So this is a custom report actually, so that, but inside DHIS2.